Hi, I'm Dr. Devin Savage from Archlifter. If you're watching this video, chances are you're dealing with spinal pain and you may have been diagnosed with degenerative disc disease or DDD. This video series is designed to give you a perspective of the problem so that you can better understand how your condition developed over time and how to make better decisions regarding prevention and therapies that you may be offered. In today's episode, I want to take a closer look at the biology and biomechanics of spinal discs. Spinal discs are the shock absorbers that function to keep the vertebrae apart. They are the key to the range of motion and resiliency of the spine. So what actually happens when the discs wear out and start to cause pain? So let's have a look at the problem. Well, first of all, when you're a young person, the discs are tall, hydrated, and healthy, and they do a good job of being the elastic component, the shock absorbers of your spine. They do a great job when you're young. The problem starts when you get older and you have that sedentary type of American or European lifestyle. As we get older, those discs become more and more compressed, and they can no longer function as shock absorbers of the spine. So these discs here, they're very compressed. They show signs of disc wedging from chronic forward head posture, bad posture, work posture, whatever. The wedging pinches the discs in the front of the spine, and you can see how the contents of the discs have been pushed backwards, where the spinal cord and nerve roots are. So this is very typical. This is what pinched discs really look like, and it's also called the wedging effect. So when the disc doesn't have enough space, this is what it does. There are actually two things it can do. First of all, it can shrink down to fit the space. However, this takes many years, and it's part of the aging process. Or the disc can extrude out of the space into the surrounding area like this. As you can see, this is exactly what happened to this patient. And when it starts to put pressure on the spinal cord or on the nerve roots, that patient's going to get symptoms. And you can see this patient suffered a lot. That's why they came in, and that's why we have this MRI. In this case, the disc herniation is so large, it's pressing on the spinal cord. Yeah, these results can be really, really debilitating. So, and these discs need to heal, but there's just no room for them to heal. And so a typical treatment, the first line of treatment, the doctor's going to come in and say, okay, let's inject steroids into the inflammatory soup that's surrounding the painful area. And the hope here is that some of the steroids are going to make their way into the center portion of the disc or joint. But how is the doctor going to get medicine or any fluid to diffuse into a compressed, squeezed disc? It's like putting the toothpaste back into the tube. So, unfortunately, steroid injections offer temporary relief at best. In some cases, they're diagnostic. If the patient gets some relief, the offending disc or level can be identified pretty closely. But what's really needed here, it's not injections. The problem is basically a flat tire. You need physical separation of the vertebrae. It's a reversal of the normal course of events. So these discs don't have their own blood supply. In order for them to recover, they need to take in most of their healing nutrients from the surrounding intracellular fluid. Each disc gets nourishment from the accordion-like daily normal movement of the spine. Fluid goes in and fluid goes out. But what does the average person do? Nowadays, in our office culture, they sit. They sit at a desk. They sit at a computer. They sit for their job. They sit on a factory line. Their head is forward and they're sitting. They don't, like our ancestors used to go out and hunt and gather or work on the farm or whatever. Our culture, we sit. So the Archlifter neck and spine fitness device helps isolate and train the spine at home and in the gym. You can stretch and exercise your spine daily for maximum fitness that takes the place of that normal exercise that our ancestors did and that we don't do. What the Archlifter is really good at is it allows the spine to elongate slightly with forces directed on the long axis of the spine. It's actually helping the natural pumping action of a healthy spine in order to get it moving again so that water and nutrients can reach the interior of the discs. So the Archlifter is giving the discs some space so that they can recover. And, it's giving the discs relief from all that compression. It's physically separating the bones, the vertebrae, these vertebrae, and giving the discs a chance to bounce back. The Archlifter basically when you combine it with a sensible workout regimen, it helps you get moving again. It gets your neck and your back limbered up, and it gets you on the way to better function with less pain. I hope you see us on the website Archlifter.com and Facebook. Thanks for your attention.